Do you know what these are, guys? These are the triple A's of first aid medication. So what I mean by that is you are allowed to keep, carry, buy, share, use these three drugs. So I say the triple A's of first aid meds, and that's because each of these drugs I relate back to the letter A. Asthma, aspirin, anaphylaxis, or adrenaline. So we use adrenaline to treat anaphylaxis. You are allowed to give this as a first aider. You are allowed to borrow it. You are allowed to buy it, and you are allowed to keep it in your first aid kit without a script. You can get this over the counter. This is super expensive. It's like over $100 and it's only good for 12 months. But this is one dose of a life-saving drug. That's drug number one. Drug number two, it's actually called salbutamol, but the A is asthma. So we've got anaphylaxis, we've got asthma. And it's the drug inside that's always going to be called salbutamol. It doesn't matter what color. So I always say blue lips, blue puffer. You're allowed to use this one. You're allowed to keep this one. You're allowed to borrow this one. You're allowed to buy this one. You can ask in the crowd, does anyone have a puffer? I need to use it for some first aid. May I please borrow it? So most people are going to lend you their puffer if you need it. I'd personally just buy them a new one rather than giving it back half cut. Okay, the last one you are allowed to play with is aspirin. So we give 300 milligrams of aspirin to a patient who is suffering from chest pain if they are still conscious. And the key here is we don't want it to be dissolved under their tongue. We want them to chew it. It's gross, but they're going to chew it, and we want it in their gut. It needs to go into the stomach to be absorbed effectively. So the triple A's of first aid drugs that you're allowed to give, buy, keep, and use: adrenaline for anaphylaxis, salbutamol for asthma, and aspirin for heart attacks, 300 milligrams. The triple A's of drugs in first aid. Don't forget, you have to have consent from the patient, and you should always just, as a matter of good practice, are you allergic to anything that you know of? That's really important. But legally, you are protected and expected to give those drugs if you have them available, the patient consents, and they've got all of those signs and symptoms to justify giving that drug.